with President Trump testing positive for COVID and now at Walter Reed Military Hospital. I wanted to update you and explain some of the things that have been going on. I've been getting some questions about this. But first, I wanted to read the letter from his personal physician explaining exactly what we know at this point. This is from Sean Conley, who says, following PCR confirmation of the president's diagnosis, so I'm going to read all this and then I'll go back and explain it. A precautionary measure, he received a single 8-gram dose of Regeneron's polyclonal antibody cocktail. I'll explain that. He completed the infusion without incident. In addition, the polyclonal antibodies, the president has been taking zinc, vitamin D, famotidine, melatonin, and a daily aspirin. As of this afternoon, this was earlier today, the president remains fatigued but in good spirits. He's being evaluated by a team of experts, and together we'll be making recommendations to the president and First Lady in regards to the next best steps. First Lady Melania Trump remains well and only with mild cough and headache, and the remainder of the first family are well and tested negative for the SARS-CoV-2 today. So let's break this down kind of sentence by sentence just to explain, what we actually know right now. First of all, the president had PCR confirmation of COVID. PCR is the nasal swab. It's often rapid now where you can get the results within 30 minutes, if not an hour or two. So he had that done, and that's the basis of his confirmation diagnosis. That's the main way that we confirm COVID. As a precautionary measure, he received a single 8-gram dose of Regeneron's polyclonal antibody cocktail. Let's break that down. So Regeneron, there has been some evidence that suggests maybe it can be useful, and at this stage in his illness before somebody potentially gets really ill. But it is a little bit experimental. What does polyclonal antibody cocktail mean? What it means is they took an antibody, a human antibody, and they cloned it in a lab, basically just made more. And then they also, this cocktail is a combination of that, and then it also includes antibodies from someone who has recovered from COVID. So the two of those together go in this infusion, again, in the attempt to kind of weaken the disease and to treat him up front so that it doesn't get worse. It said that went well. Additionally, he's been taking these 5 medications: zinc and vitamin D. Zinc is a mineral that's often given for colds and viral illnesses. We sometimes do give it with COVID. Vitamin D, there's a lot of benefits for that, not just osteoporosis, potentially heart disease. It also is commonly given with COVID. These other 3 medications don't have anything to do with COVID. Famotidine, it's like Pepcid. It's often given for gastritis, reflux. It's an acid-blocking medication. Maybe Trump has GERD. Melatonin, which is a sleep aid, and a daily aspirin, which is commonly given to prevent heart attack and stroke. Now, on this list, it's good to see Trump is not diabetic. I don't see any high blood pressure medications. I don't see cholesterol medications. Presumably, if he doesn't have any of those 3 conditions, that is good news for him in terms of his doing well with this disease. His weight is a little bit high. That's going to be a risk factor. He's in his mid-70s. That's a risk factor as well. But again, most people at his age, with his comorbidities, do fine with COVID. So the numbers at this point, with what we know, are far in his favor that he will recover fine. And that's what we know now. This is an evolving story, and I'm sure that they will keep us posted as to the condition of the president. This is a really big deal. There were some people who were asking me initially, a lot of people who were skeptical, is he using this politically? It's a month before the election. This really appears to be very legitimate and a real concern. And of course, Democrat or Republican, everybody should be wishing the president well and a full recovery for him, the First Lady, and everyone that is affected from this COVID.